how I'd like to start is I'm going to give actually everybody a number, and I want you to remember your numbers. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. So if you have the number 1 or uno, please stand up. Those of you who are standing right now represent the number of people in this room that are going to die from heart disease. 1 out of every 3 adults dies from heart. So cancer has received a lot of attention in the last decade or two, but if you add up all the cancers that there are, from breast to pancreatic to colon, it still does not outpace heart disease as the number 1 cause of death in the United States. And so this problem of heart disease being the number 1 killer is a problem of our generation. It's the first generation that has to face this problem because people didn't die from heart disease 100 years ago. This figure shows the number of people that died from 1900 to 2015. And you can see in 1900, nobody died from heart disease. We died from influenza, from pneumonia, from tuberculosis. But we developed antibiotics, vaccines, medicines, and we have better hospitals. And as a result, now people die not from infectious disease, but from chronic diseases that occur over a lifetime. And so what this means is that heart disease is really an aging problem. That this figure shows how many people in the US have heart disease by age group. 20 to 39-year-olds, about 13% have heart disease. By the time we get up to 80-year-olds and above, 85% have heart disease, which means if you're lucky enough to live to your 70s and your 80s, the chances are that you're going to have to face and deal with heart disease. And it's not just the fact that heart disease will kill you, because certainly we could all just say here, I'm going to die from something. If I die from heart disease, no big deal. But the thing is, heart disease is also going to rob you of healthy years. Right? We all want to live to be 100, but we want to live to 100 where we're still able to clothe ourselves, bathe ourselves, go to the bathroom ourselves, eat ourselves. But with heart disease, it takes away that ability to do so for many people. What you see listed here are activities that people do throughout their day. And the percentage of patients with heart disease who report having problems doing those activities. In particular, you'll see 26% of people have struggled just being able to do their household chores. 29% struggle walking. And almost half, 1 out of every 2, have difficulty climbing the stairs. So it's not just about causing death, but it's also robbing you of your ability to do everyday functions. And so with that said, hopefully I think those statistics highlight that heart disease is a problem that we should be worrying about. But let me just take a step back and just define what exactly is heart disease. Heart disease is an umbrella term that basically means any condition that affects your heart or your blood vessels. So it includes things like coronary artery disease, the stiffening and clogging of your arteries. It includes things like cardiomyopathy, the enlargement of your heart in a bad way. It includes things like heart failure, which doesn't actually mean that your heart fails and stops, it just means your heart gets weaker. And it includes things like abnormal heartbeats or arrhythmia, something like atrial fibrillation. These are what we mean when we say heart disease. And the most common type of heart disease is coronary artery disease, which I'll talk about in a second. So coronary artery disease is most commonly understood as a process of atherosclerosis, which is just plaque building up in your arteries. So this is what a normal healthy artery looks like. Blood flows smoothly through that artery. Atherosclerosis is a process in which plaque builds up in your artery. And why this is a problem is because blood is supposed to be flowing through that artery, and when you have too much plaque, not as much blood can get through. And why blood is important is because blood delivers oxygen to our heart, to our brain, and all of our organs. And if those organs don't get oxygen, they stop working, those tissues and organs die, and we die. So this is why atherosclerosis is an important process that we have to understand and prevent. So what our atherosclerosis most commonly contributes to, and what we most know it for, is heart attacks. So a heart attack is essentially, you have your blood vessel here in your heart that becomes clogged because of plaque buildup. Because there's plaque buildup, blood doesn't get through. And as a result of blood not getting through, there's no oxygen to this area of the heart. that area of the heart starts to die without oxygen. If enough area of your heart dies without oxygen, your heart stops working. So that's what a heart attack is. So an important process to know, and an important point to make, is that atherosclerosis is a lifelong process that starts the minute you're born and may actually even start while you're in the womb. So this figure shows an artery of a person from 0 all the way out to 70. And you can see over time, plaque gradually builds up in their arteries until they hit middle age, when they start having symptoms. They start having chest pains, and you start having things like a heart attack or a stroke, among other symptoms. And to re-emphasize, this is the problem that starts young and that we should be worrying about it now, even if we're healthy. This figure shows how many people of children and young adults who have atherosclerosis in their carotid arteries or their coronary arteries, their heart arteries. 2 to 15-year-olds, so children, about 8% have plaque in their heart arteries, which is not much. But by the time we get to 26 to 39-year-olds, so young adults still, 70% have plaque buildup in the arteries of their heart. Right, so which means the chances are that most of us sitting in this room have some form of plaque buildup already going on in our hearts. So the question is, if we all have plaque buildup already going in our hearts, what do we do about it? And the first thing I want to say is that there is no quick fix. So there's a tendency by many to think that having medical procedures done, like bypass surgery, where we cut our chest open, we take a vein from our leg and put it in our hearts to give us a new artery that's supposed to be cleaner, or percutaneous coronary intervention, or what more people know as angioplasty, where we just put a wire through a vein in your groin, go all to your heart, and inflate a balloon to clear out the plaque. There's a tendency to think that those procedures fix us, can cure us. But what I want to point out is the fact that these procedures don't fix a damaged heart, damaged arteries. If you have a heart attack, bypass surgery is not going to fix the damage to your heart that occurred. We can't change that your tissue died. The same with your arteries. We clear the plaque, but those arteries are already unhealthy. They're already damaged. Clearing the plaque will help you live a little bit longer and prevent pain from occurring, but it doesn't fix what caused that process to occur. So the changes that people have to make is the changes of their lifestyle that contributed to this happening over the course of their life. So a story that I'll tell you guys, I have a family friend who recently had quadruple bypass surgery. And he was in the hospital for many days because it's open heart surgery, and so you have to recover. His wife, when he came home from the hospital, was excited that he was home and thought, I'm going to prepare him a good meal because he's been eating hospital food for so many years. And so she decided to prepare him one of his favorite meals. And it was a big, juicy, fat hamburger with cheese and bacon. And we asked her, your husband just had quadruple bypass surgery. Why are you giving him this? And her response was, he just got a new artery in his heart, or a couple new arteries in his heart. He got so many years left to live now because he's got new arteries. And that's a perception that many people have, that they think that that's a cure. But the problem is it's not addressing the behavior that caused him to have quadruple bypass surgery. And his heart was already damaged because he had heart disease. So now he's already at greater risk for having another heart event. So with that said, given that heart disease is the #1 killer in the United States, that most of us probably have some atherosclerosis already in our arteries of our heart, I want to say that the time to act is now. This process keeps going and keeps furthering, and you want to tackle this process and stop this process as soon as you can. In particular, because late may be too late. 1 out of 3 people who have a heart attack don't survive that heart attack. Right? So this is when you need to act, before it occurs, not waiting till after, or when a doctor tells you you need to have angioplasty. You want to stop this process now. So with that, what I want to do is just make everyone aware of whether you're at risk right now for heart disease. So what I have on this board or this slide is a couple of questions that I'm going to ask you. Just be mindful and count the number of times that you say yes. And we're going to calculate what your risk is for heart disease by counting the number of times that you say yes. Are you over the age of 55? Do you smoke? Do you exercise less than 30 minutes? Do you have a father or brother who had a heart attack before the age of 55? or a mother or sister who had a heart attack? Is your blood pressure 140/90 or higher? Or have you been told by your doctor that your blood pressure is too high? Are you overweight? Has a doctor told you that your total cholesterol is more than 200 or higher, or your good cholesterol, HDL, is less than 40? Do you have diabetes or a blood sugar of 126 or higher? Or do you need medicine to control your blood? Has a doctor told you that you have angina, chest pains, or... So count up the number of risk factors, the number of times you said yes. If you had one risk factor, you have double the risk of... If you have two risk factors, you said yes 2 times, you have quadruple the risk for heart disease. If you have 3 or more risk factors, you have a more than 10-fold risk. So this is a very, very rough calculation of heart disease risk, but I hope just highlights the fact that I think most of us in this room, including myself, have at least one risk factor. Most of us are at risk for having heart disease. If you're interested in knowing what your in the next 10 years, how much risk you actually have, this is a very rough estimate. You can go to this website. So with all that terrible news that I just gave you guys, what's the good news? The good news is it can be prevented and controlled. So let's talk about what we can control. So what I list here are the causes of heart disease. Oops. And so the causes of heart disease include high cholesterol, diabetes, obesity, your genetics, your high blood pressure, inflammation, smoking, and how old you are, your age. If you count up what we can control, the only things we can't control are genetics and age. Everything else we can control. So exercise itself can reduce your risk of heart disease by just helping the health of your heart and your blood. But beyond that, here's the really important thing about exercise, is it can control your other risk factors. It can lower your cholesterol, your diabetes, your obesity, your blood pressure, and inflammation. So not only is exercise going to help your heart directly, it's also going to influence the things exercise, what it's going to do and how it helps, how exercise is medicine for your heart, is it lowers your blood pressure, your total cholesterol, your bad cholesterol, your triglycerides. It raises your good cholesterol, lowers your blood sugar, and lowers your body. In addition to changing your risk factors for heart disease, it acts directly on your heart and blood vessels. So one of the things it's going to do is make your heart pump better. So if your heart pumps like this, whoosh, whoosh, whoosh. When you exercise, over time your heart's going to start beating like this, whoosh, whoosh. Every time it pumps out way more blood because it's stronger. What it's also going to do is the blood vessels around your heart are going to dilate better. They're going to open up better, which means you're going to get better blood flowing. And what it's also going to do is something called angiogenesis, which basically means exercise actually causes new blood vessel branches and connections to form. So if you have, why this is important particularly for heart disease, let's say you have an artery that's already starting to get clogged. What exercise does is actually helps you form new connections so that the blood can go around that clot and through different pathways to still get oxygen to your heart. So if we were to count up all the things that exercise does, and this is why I say exercise is medicine. Let's say we didn't exercise and we want to do this through medicine. To lower our blood pressure, we're going to take medication. To lower our cholesterol, we're going to take a medication. To lower our blood sugar, we're going to take a medication. That's 3 medications right there. Then, let's say we want to lose weight. We can try diet, or for a lot of people, what they end up doing is something like lap band surgery. So now we're talking about the equivalent of 3 medications and potentially surgery. And what that doesn't even touch is the fact that exercise is also doing these other things, making your heart pump better, creating new blood vessel connections. No medicine on this earth can do those things. So one of the things that people say, like, medication is easy, I just take a pill and I start seeing benefits. So the question is, with exercise, how soon can I start seeing benefits? And the answer is immediate. So if I got everyone to exercise right now, we went out for 30 minutes. After that exercise, for the next several hours to 24 hours, your blood pressure is going to be lowered about 5 to 10 millimeters. In addition, for the next 24 hours, your blood glucose or your blood sugar levels are also going to be lowered. If you were to keep exercising every day for the next several days, within about a week, you're going to start seeing your fitness levels improve. You're going to be able to walk upstairs more easily and do your everyday activities without being... And if you kept it up for several months, you'll start seeing weight loss. Your cholesterol and triglycerides are going to improve. Those new blood vessel connections I talk about are going to start to form. And you're going to maximize reductions in your risk factors. So things like your blood pressure, they're not going to just drop 10 millimeters and go back up. They're going to drop and they're going to stay down. That's going to be your new blood pressure level. Hopefully you guys are now like, okay, this is great. What do I do now? If I want to start exercise, I want this for my life. What do I do? And so what I'm going to talk to you about is an exercise prescription. Just like when a doctor says you have high blood pressure and you need to go on medication, they give you a specific type of medication at a specific dosage, and they tell you how many times you should take that medicine. In the same way we prescribe exercise, there's a specific dose that's supposed to be good. So we call this prescription the FIT prescription. And I'm going to take you guys through what each component of a FIT prescription means. The F stands for frequency, the number of times per week that you exercise. For example, I exercise 3 days. The I stands for intensity, how difficult that exercise feels for you. For example, I will exercise or I will walk at a moderate. The first T stands for time. How many minutes per each exercise session will you go for? So for example, I will exercise for 30 minutes. So what I'm going to do is take you through what the FIT prescription looks like for heart health. But what I want to say is that a lot of this that you see here in the last 2 to 3 years has completely changed. We as a field have changed and simplified what a prescription looks like, and I'll talk about what those changes are. So the first component I want to talk about is type. There are 3 types of physical activity. The first type is aerobic activity, or what is more commonly referred to as cardio, which is activity that works your heart muscle, and is any activity that can be sustained for more than a few minutes at a time and gets your heart rate elevated and your breathing rate increased. And for example, are things like walking, running, swimming, biking, dancing. The second type of activity is strengthening activity, or what's often referred to as weightlifting, which is any activity that's designed to help your other muscles, not your heart muscle, but every other muscle in your body, from your biceps to triceps, your leg muscles, your quadriceps, and your hamstrings. And it's things like push-ups, sit-ups, lifting a weight. And the last type of activity that there is stretching, which is designed to improve your flexibility and movement of your joints. And it's things like touching your toes, doing side stretches, doing yoga poses. So we tend to think about these different types of activities as an activity pyramid in terms of how much you need of that activity. We need strength and flexibility exercises occasionally, 2 to 3 times per week. We need more aerobic activity, so exercises for our heart, more often, about 3 to 5 times. And then there's just the everyday activities that we do to get to the subway, to do our household chores. This represents a large chunk of our activity. What I'm going to focus on today is this. Because if you're interested in improving your heart health, this is what we should be focusing on. Now, with that said, I don't want to just dismiss weightlifting and strength training and say don't waste your time. It's still important. Strength training, or weightlifting, is going to increase the strength of your bones, muscles, tendons, and ligaments. And why this is important is because as we age, our muscles waste away. It's called sarcopenia. And our bones start to waste away, become more brittle, called osteoporosis. Weightlifting and strength training is the only known thing that can stop the loss of muscle mass as we age. There is no medication that can stop that at this point. There is medication to slow and stop osteoporosis, but it doesn't work as good as strength training. And why strength training is also important, I'll skip a couple of these, but quality of life. It's about when we get to our 70s and our 80s, still be able to carry our groceries, still be able just to open a jar. And so strength training is important because it allows us to still function independently. So with that said, though, we are going to focus now for the rest of this time. It's about aerobic activity. So with that fit prescription, that last T, tight, the fit prescription for heart health is to do aerobic activity. So the second component I'm going to talk about, the I, your intensity of activity. There are 3 intensity levels. The first is light intensity activity, which doesn't require much effort and is usually just the common everyday activities that you do throughout your day. The second type is moderate intensity activity, which increases your heart rate and your breathing rate. And if you were to rate it on a scale from 0 to 10, 10 being as hard as you could possibly exercise, it would be about a 4 to 6. The third type of intensity is vigorous intensity activity, which works your heart, your lungs, and your muscles to its absolute capacity. On a scale from 0 to 10, it would be a 7 or higher. So a good rule of thumb to figure out what intensity your exercise is, because you're surely going to see that I'm going to promote and recommend we do this kind of exercise. To determine how intense your exercise or your activity is, we use something called the SING test. It's a very simple thing to do. Light intensity, you can sing while you're exercising. Moderate intensity activity, you can easily talk while you're exercising, but you're not able to sing. And vigorous intensity activity, it's difficult for you even to get a few breaths out or talk words out while you're exercising. So the question is, does the intensity of your exercise matter? So what we have here is someone's day, where most of their day is spent sedentary, inactive, sitting. Then we have light intensity physical activity, and then the moderate and vigorous physical activity. So if I were to replace 30 minutes of your sitting time with 30 minutes of light intensity physical activity, it's going to lower your risk of death, if you did it every day, by about 17. If I replaced your sedentary time, your inactivity, with 30 minutes of moderate and vigorous physical activity, it's going to lower your risk of death by 35%. So to answer this question, does the intensity matter? Yes and no. No, in that any exercise, as you saw from my last slide, any intensity exercise is going to lower your risk of heart disease. But I said no, it doesn't matter at first, but yes, in that the more intense activity that you do, the more benefit. So there's a phrase that's often used with exercise, no pain, no gain. That's not true. Exercise doesn't have to hurt, and it doesn't have to be uncomfortable. The simple message that I can recommend to you guys is just move. Doesn't matter how intense, just get out there and move. Now there is a time trade-off. So what you see here is this is how many minutes a person exercises, and this is how much they lower their risk of death. This line here represents moderate intensity activity, and the blue line here represents vigorous intensity. So you can see that you reap far more benefits more quickly, doing vigorous intensity activity than if you were to do moderate intensity activity. So the rule of thumb is 2 minutes of moderate intensity activity is the same as 1 minute of activity. So a benefit to doing more intense activity is that 15 minutes of vigorous intensity activity is the same as doing 30 minutes of moderate intensity. So if you're short on time, vigorous intensity activity is very time efficient. So that's one of the more benefits of doing vigorous intensity. Another benefit of doing vigorous intensity activity is it improves your cardiorespiratory fitness more than lower intensity activity. And so what cardiorespiratory fitness is the ability of your body to move oxygen to your organs. So it means it represents the health of your lungs, the health of your heart, and the health of your blood vessels. Fitness levels are thought to be a better predictor of your risk of heart disease and death, and just an overall indicator of your health than your blood sugar levels, your blood pressure levels, and your cholesterol levels. This is the best predictor of your health and your future risk. So vigorous intensity activity offers a couple of benefits that I think are worth considering, but there are some cons. One of them is increased risk of injury. Particularly if you're new to exercise, haven't exercised before, I wouldn't recommend you guys just start all of a sudden going full all out. Another con is vigorous intensity activity can be unpleasant, uncomfortable. It can hurt a little bit. And so for a lot of people, they're not looking to make themselves hurt. So when it comes to figuring out what intensity activity I should do, you have to weigh the pros and cons. But I will say for this unpleasant, uncomfortable feeling, that feeling goes away rather quickly. And for many people, they like that feeling of like they've accomplished something, they've done something. So it's something to consider. So if you're interested in understanding, well, what type of activities I could do that would be moderate or vigorous in intensity, these are the types of activities that are moderate or vigorous in intensity. So biking, swimming, brisk walking, basketball, gardening if it's continuous, running or jogging, playing soccer, doing aerobics classes, dancing, or the elliptical or stair-step regime. To summarize thus far, type for heart health is to do aerobic activity. The intensity prescription for heart health is really any intensity activity, but the more intense, the better. Now I'm going to talk about the final two parts of that fit prescription. Frequency, how many days per week, and time, how many minutes per exercise session. So the US government just recently formed a committee that was charged with developing new physical activity guidelines. So here's what they said about frequency and time in their latest report. The total volume of moderate and vigorous physical activity is more important determinant of health benefits than the number of days per week in which an individual performs activity and the duration of the episodes that comprise the total volume. So what that basically means is they said, doesn't matter about how many days a week you do it, doesn't matter how many minutes at a time you do it for each exercise session, it's just about getting volume in of exercise. So to illustrate and explain an example, the weekend warrior. Someone who, they're too busy during the week because of work and other activities to exercise. But on the weekends, they go crazy and they exercise for hours. So what this slide shows is risk of heart disease for people who don't exercise, for people who exercise a little bit, and for people who exercise and get maybe 150 minutes of exercise a week, but on 3 or more occasions. So they exercise 3 to 7 times a week. And then you have the people, these are our weekend warriors. They exercise for the same amount of time, 150 minutes, but they only do it in 1 or 2 sessions. And what you'll see is the risk that they lowered, how much they lowered their heart disease risk was the same, about 40% for both the weekend warrior and for the people who exercise 3 to 7 days per week. The message that I think that you can get from this is that it doesn't matter if you exercise 1 day a week or 2 days a week to 7 days a week. It just matters that you get enough of it. So then we say, forget just how many days a week we exercise. What about how long we exercise for? And so what this slide shows is your risk of death. If you just got your exercise in of 1 to 5 minutes at a time, if you did it 5 to 10 minutes at a time, your exercise was in length, or 10 minutes or more. And what you'll see is that your risk of death is lowered no matter if you just did 1 to 5 minutes, 5 to 10. So I think the short message here is that it doesn't matter if you just take a 1 minute activity about 150 times, that would still work. You don't have to necessarily go for 30 minutes at a time. It's just about getting enough activity, no matter how much you get it, whether it's 10 minutes at a time, 1 minute at a time. So then the question is, if any of that stuff doesn't matter, well, how much volume do I need? So what this slide shows is the minutes of exercise by risk of death. And so what's a couple of points I want to point out here. First is that you see that your risk immediately starts going down. There is no threshold that you have to reach for you to achieve benefits from exercise. You did 1 minute of exercise, that's going to lower your risk to some extent. The other important point I want to point out here is that there's a steep early slope. So you reap the benefits of exercise very quickly and very fast early on. So you can see even up to just 60 minutes in a week, you've already have substantial benefit. By the time you get to 150 minutes a week, you've reached 70% of the benefits that can be achieved from exercise. So going out to 500 minutes only gets you another extra 30% benefit. There are 2 points I want to make. The first is, the simple answer is any movement is going to provide health benefits. So I wouldn't get too caught up in how many minutes I'm doing a week. Any movement is going to be beneficial and helpful to you. That's the simple answer. But based off of the slide that, let me stop that. But to maximize your benefits, as you saw on that slide, what the American Heart Association has recommended is that we do, per week, 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity. Remember, I talked about the fact that there's a time efficiency here with vigorous. So to summarize what the fit prescription is for exercise for heart health, it's aerobic activity at any intensity, but the more intense the better, for 150 minutes per week. That only represents 150 minutes in a week, represents 2% of your entire week, assuming you slept for 8 hours. So let's take an example of a day in the life of an exerciser, who, like the good exerciser they wake up at 7 a.m. and immediately go for a brisk walk for half. But then what happens is after that, they have breakfast for 15 minutes, and then they get in their car and they drive to work for 45 minutes. And they work for 3.5 hours, eat lunch for 30 minutes, and work for another 4 hours. Then they get in their car, drive home for 45 minutes, eat dinner another 30 minutes, and then sit on the couch for the rest of the day another 4 hours. So what this represents is another 15.5 hours that this person has. While certainly this 30 minutes of exercise is going to help your heart as well as your general health, what we're also starting to realize is that this 15.5 hours when you're not moving at all also is going to have harmful consequences for your heart and your body. Maybe perhaps some of you guys have seen the news headlines in the last year or two. This phrase that we've been starting to use a lot is this notion that sitting is the new smoking. And there's been headlines like, sitting for hours can shave years off your life. Why your desk job is slowly killing you. You're sitting yourself to death. Yes, sitting too long can kill you, even if you exercise. Many of you, I think you may not realize it, we only realized that exercise is good for us about 50 years ago. So many of you, I think, were born before we even realized that exercise was something that we all should be doing. And so you grew up not knowing that exercise was something you should do every day. So we're just learning more about exercise. And one of the things we're recently learning, that it's not just about checking off a box for exercising for 30 minutes. That what's actually probably more important is just moving throughout our day and just avoiding periods where we sit for hours at a time. So here's an example of this study looked at how many hours a person watched television a day, sitting, and their risk for diabetes. And they looked at people who didn't exercise. They looked at people who exercised occasionally, and they looked at your avid exercisers. These are like your marathon runners. And what they saw was that in the non-exercisers, the more time they watched television, the greater their risk for diabetes, as you'd expect. But what was really surprising was that they found that these marathon runners, these avid exercisers, even in this group, the more time they spent watching television, the greater their risk of diabetes. So what this really led us to start to understand is the fact that even among exercisers, how much time you spend sitting outside of your exercise still matters. So based off of this new evidence that has only come out in the last 5 to 10 years, the American Heart Association has also released another recommendation outside of exercise for 150 minutes. They're also now starting to say to people, sit less, move more. So here's what, according to the American Heart Association, an ideal day would look like. So there's 4 people here, with the person on top having the highest risk for disease, and the person on the bottom having the lowest risk. This is the best type of activity profile. So this person on the top doesn't exercise and sits all day. This person here, Mike, second to top, he gets his exercise in and sits for the most of the rest. Kim exercises and is moving a little bit throughout. And then lastly, Joe, who exercises but throughout the day is getting up and moving around and never sits for an hour at a time. So according to the American Heart Association, this is what we all should be striving for. So with that said, I recognize what I'm telling you is a lot to ask. I'm telling you you should exercise and then move all day. So I want you to think about it in a different way, and this is how the U.S. government is starting to encourage everybody to start thinking about it. So this figure on the bottom here is how much time you spend doing exercise, or moderate and vigorous physical activity. On this side is how much time you spend sitting. The green represents lowest risk of heart disease. The red represents highest risk for heart disease. Now there are a couple ways that you can go about lowering your risk. One is you can just decide, I'm just going to exercise, and that's all I'm going to do. And that shifting that over, you're still going to sit a lot, so you're going to probably be about here, and maybe you get 30 minutes of exercise in a day. That brings you here in the yellow. Or you can say, I'm still going to sit all day, but I'm going to exercise a ton, and I can still lower my risk a lot. Or you can say, I don't have time to exercise, or I don't want to exercise. I'm just going to make sure I move all day and just perpetually not sit for long periods of time. So that's going to reduce my sitting time, and maybe I'm here on the physical activity spectrum. So I've lowered my risk. And of course, if you moved all day and you exercised, you're going to end up. So it's about finding what balance is going to work for your lifestyle. The first thing I want to say is it ever too late to get started? So here's an example. This is an artery before a person exercised and after they exercised. In addition to helping your arteries, let's talk about your heart for a second. This is what a normal heart looks like, and this is the ventricles where your blood fills. As we age, our heart gets stiffer. So what happens when we age is our hearts get stiffer, and they can't fill with as much blood, and they don't. So here's what happens when we exercise. So this group, this was before exercise. This is the group that didn't exercise at all. Before and 2 years later, you can see their stiffness of their heart goes up. Now this group that exercised, this is before they exercised, and then 2 years later, and this is a group of people who were middle-aged and never exercised before. They reduced their heart stiffness in 2 years. So my message is, it's not too late to start, because it can still reverse some of the plaque that's built up. And it can reverse the stiffening of your heart. And so some of you may have already symptoms of heart disease, and may even have heart disease. And my message to you is, you can't change the past, but you can still change your heart's future. Exercise, even if you have heart disease, is still important. And so the key here, I'll say, is it's going to lower your risk for having a future heart attack. What I also want to show you is, I want to compare exercise to this angioplasty, this putting a balloon into your artery and inflating it to clear out the plaque and then taking it out, that people often do and think is a cure for their heart disease. So what this shows is, for 12 months after this person had their procedure or started an exercise program, and the number or percentage of people who ended up not having a heart event. Of the people who had angioplasty, 70% didn't have another heart event for the next year. For those who just started exercise and didn't have the angioplasty, 88% didn't have a heart event for the next year. So both were good, but exercise was better. Bad news. The exercise you did 30 years ago doesn't matter. So the benefits that I'm talking about persist as long as you're maintaining. When you stop, those benefits go away very quickly. How quickly? A matter of a month. So with that said, I've talked a lot about exercise in the heart, but I want to also emphasize the fact that the benefits go beyond heart. These are all the causes of death in the United States, and I've highlighted all of the things that exercise can help. Heart disease, cancer, stroke, Alzheimer's, diabetes, kidney disease. Exercise can all help prevent. In addition, exercise can help with mental disorders, can reduce anxiety symptoms, can reduce depression. It also can help with physical disorders and reduce the risk of having arthritis, osteoporosis, as well as help manage those symptoms. So when you add up, if you were to look at all the medicines that would be required to help lower risk for all these things, that's why exercise is known as one of the few things that can add years to your life. Every hour of moderate intensity that you do adds 3.2 hours to your life. Every hour of vigorous intensity activity you do adds 6.4 hours to your life. With exercise, you get from it more than you put into it. So you put in 1 hour, you get 3 hours or 6 hours. With all these benefits, it's why this man, Robert Butler, came up with this famous quote that said, if exercise could be packed into a pill, it would be the single most widely prescribed and beneficial medicine in the world. And so the beautiful thing is it's free. So with that said, how do we get started? So some tips to help you guys get started, and I'm going to wrap up very shortly. Make exercise a part of your daily routine. The example I use is brushing your teeth. It's something that a lot of us don't even think about. It's just so programmed that we do it that there's no like struggling, do I want to brush my teeth today? Am I going to do it? We just do it. It's ingrained in our mind. And so it's about just carving, not trying to just fit it in when you can, but this is part of my routine. This is part of my day. This is my fine exercise you enjoy. Don't do something you don't like. The odds that you're going to keep it up if you don't like it are sick of time. But be active with friends, right? So getting your children or your spouse involved, having that support to keep you motivated, to keep you going when you don't feel like it. To have someone who holds you accountable goes a long way. If you're going to start, and you haven't exercised before, start low and build slow. So 10 minutes. Just walk for 10 minutes. And then the next week, walk for 15 minutes. And you keep building. So don't try to go for the full 150 minutes all at once. And for many of us who are extremely busy and it's hard to find time, a strategy that can be used is to just build everyday activities to make yourself more active. Incorporate activity into your everyday life. So for examples, take the stairs instead of the elevator or the escalator. Get off the bus or subway one stop early and walk. Or better yet, don't even take them at all and just walk. And so then there's a lot of things that we can do where we rely on modern conveniences, where we don't necessarily have to. Washing the car by hand, shoveling snow, raking leaves instead of using a dog. Don't just take the dog out to do its business and then bring them back in. Take them for a walk. For those who have children and spend all your time at sporting events, you don't have to sit there and watch the sporting event. You can walk around the field and watch this. So there's a whole different, these are just a couple examples, but there's a whole bunch of things that we can do to think about how we just incorporate activity naturally into our everyday lives. I'm going to finish with just giving you guys a couple resources you may or may not know are available to you if you're interested in exercising. One is called Shape Up New York City, which offers free fitness classes every week, including yoga, Zumba, Pilates, and aerobics. A couple blocks down, it's Cardioblast Fitness, every Monday from 6:30 to 7 at the J. Hood Wright Recreation Center. So if you just went to this class, that's 60 minutes. That's going to lower your risk substantially. Just doing this once a week. The City Parks Foundation offers free yoga, tennis, and fitness walking programs. Examples include Inwood Hill Park, which is a couple subway stops north of us, that has tennis on Tuesdays and Thursdays and yoga on Mondays. Many of our senior centers offer free fitness classes and programming. Then there's groups like the November Project, which is a free fitness group that's designed just to get people together and be social and exercise together. And they meet every Monday, Wednesday, and Friday at various locations around Manhattan. You can look it up online if you're interested. Then there's the Hudson River Greenway, which is actually just over here. It runs from Fort Tyrone Park to Battery Park, and it's just a paved path. No cars, no traffic, no stoplights. It's specifically dedicated for people to be able to walk and bike. And then gyms, if you're looking for something affordable, there's Planet Fitness on 175th and Broadway. It's only $10. Park recreation centers are $150 for adults per year and $25 per year for seniors. And two are very close to us here. The J. Hood Wright Recreation Center on 174th and Fort Washington. And you can read the cartoon. What fits your busy schedule better? Exercising 1 hour a day or being dead 24?